Well, as a mom, I can tell you there are moments in my day or even in my week where I feel so overwhelmed. I'm sure you watching at home have been there with me where anxiety takes over, and in that moment, you really don't know what to do. Well, a new trend has been storming the internet, and it involved sour candy to relieve anxiety. Well, does it work? Danny asked Dr. Kohli.
Well, I don't know if you guys have seen this, but there have been a multitude of articles citing that sour candies can be beneficial to help calm panic attacks and anxiety. This is something that is completely mind-blowing, so we wanted to ask Dr. Kohli more about this. Okay, Dr. Kohli, does this actually work? And if so, why? This is crazy.
You know, it's interesting, Danny. There is some science to this, and yes, it actually does work. So if you think about what's happening in your brain when you're having panic or anxiety, you're triggering the fear response in the brain. That's called the amygdala. So the idea to eat a sour candy is to activate a different sense, so almost distract your brain into thinking about something else, which is that taste, that sour taste, which is very strong sensation, so that your brain stops thinking about the fear.
Wow. Okay. So, hey, might as well keep some warheads in your purse. I really like this. Okay. So what is, there's always a downside, right? What's the downside to this?
Yes, I don't like the idea of warheads in your purse. I would rather, yes, that you use something else, because you think about it, you're eating a bunch of sugar, first of all, right?
Yeah.
And so excess intake of sugar is not good for your health from a whole cardiovascular perspective, from risk of diabetes and what have you. Secondly, the benefits are sort of short-lived and temporary.
Yes.
And it really does depend on the degree of anxiety or panic. So if you're in a full-blown panic attack, it may not work, and over time it starts to become sort of less effective.
Sure.
And then thirdly, consuming a high sugar sort of a meal can actually in the long term increase your risk for anxiety because it gets rid of chemicals that are sort of naturally calming.
Okay. Okay. So what are some healthier alternatives to candy then?
Yep. So I like essential oils.
Oh, okay.
Because it does the exact same thing. It sort of triggers that smell sensation, and it's a strong sensation usually, which can distract your brain. If you don't have anything in your purse, you can even do something like a math problem in your head.
Okay.
Because that engages a different part of the brain. You could pick up a rock and feel the surface of the rock to allow it to sort of, you know, trigger that sensation, the tactile sensation.
Okay.
So there's lots of little things that you can do.
Okay, so engaging other senses. We don't necessarily have to go down the sugar route for all of this. So what are other interventions that doctors recommend for anxiety? I know that we're kind of getting into the months of the winter blues. What else can we do?
Yeah, so this is, like, as I said before, just a short-term fix, and it's putting a Band-Aid on the problem.
Sure.
Really what you want to do is solve the underlying circuit, which is that danger is triggered in your brain, right? So you really want to do something called cognitive behavioral therapy, where you change the wiring in the brain and really prevent that dangerous signal from being triggered as easily, or try to figure out what the triggers are for that, whether it's public speaking, whether it's being in open spaces, whatever your fear might be, try to work on sort of disarming your fear response to that. Deep breathing and meditation are really, really effective ways to control anxiety in a way that doesn't require medications. Of course, if you think you need medications for anxiety because it's pretty severe, you can talk to your doctor about a lot of antidepressants and also what we call rescue medications that can help sort of abort that panic attack from happening. But really the way to approach anxiety, not just the candy, but a kind of a multifactorial approach to think about why it's being triggered, how it's being triggered, and then retrain our brain. Our brain is a very fancy computer, and the anxiety circuit is just the one that formed, and we can sort of disconnect that and get it to think about something else.
Okay, so short term, something maybe tactile, something to distract the senses. Long term, it might be better to look at a solution to really engage that initial problem.
That's exactly right.
All right, Dr. Kohli, thank you so much. It's great to see you.
Great to see you.
Well, make sure to email us your questions for Dr. Kohli. Just send your message to MyCOCO at 9news.com and put Kohli in the subject line.